One.
Hello all, myself Rushida Yasmin, Assistant Professor from SNS College of Physiotherapy. Here I have a group of mentees. They are going to present a case which is peculiar in nature. So they have went for the clinical posting and they have seen so many patients. In that I have instructed them to present one of the case they have seen. So let's see what case they are going to present and how interesting is it. Yeah, we can start.
Good morning, ma'am. Today I brought this presenting a case on ulnar injury following a road traffic accident, mainly a post-surgical physiotherapy management. So here is a small case summary. The patient is 32-year-old male. The history of the patient is he met with a road traffic accident involving a motorcycle collision. So the injury is deep laceration near the medial aspect of the elbow. So the main diagnosis of this case is ulnar injury, and intervention for this case is surgical nerve repair. So this is the main case summary.
Yeah, it's interesting. Ulnar injury can be treated in many ways, but after surgical management, we need to be very conscious in our physiotherapy management. So let's see how it progresses. What's the next?
Anatomy and mechanism of injury. The anatomy is the ulnar originates from the medial part of the brachial plexus, mainly from CD and T1 nerve root. Courses of ulnar nervus travels along the medial side of the arm, passes behind the medial epicondyle of the humerus, enters the forearm and supplies intrinsic muscles of the hand. Because of the superficial positioning near the elbow, it is highly vulnerable to injury, especially in the trauma like road traffic accident. Mechanism of injury in this case are direct trauma and laceration of the elbow, resulting in destruction of nerve continuity, required surgical repair.
Yeah, next.
Clinical features. The patient presented with typical signs of ulnar injury. The motor symptoms include weakness in handling, difficulty in finger adduction, clawing of fourth and metacarpal ulnar problem. The sensory signs include numbness and tingling in little finger and medial part of ring finger. The special signs include positive forward sign and positive forward back sign. These impairments affected the patient's ability to perform daily activities.
So there was a positive signs of ulnar injury noted in the clinical features. So what is the next line of surgical management and what can be used in the physiotherapy?
So, as per our case study, the patient underwent ulnar repair. So, what the surgical management for them would be end-to-end suture and nerve end grafting. After surgery, mobilization would be advised for them to undertake. Then, the physiotherapy assessment for them would be motor examination. It examines the ability of muscle, then sensory examination and examining the range of motion and functional assessment. At last, observation, which means we observe deformities in problem.
Yes. Could you please explain physiotherapy management stage by stage?
The post-surgical physiotherapy management is the early phase. The early phase should protect the surgical repair, education patient on positioning, maintaining range of motion on unaffected part. Second phase is intermediate phase. The gentle range of motion exercise can be given to the patient. Nerve gliding exercise and it's used to prevent the joint stiffness. And the third is the strengthening phase. In strengthening phase, the strengthening of the intrinsic hand muscles can be provided. And grip strengthening exercise is used to function the hand training. And the last phase is functional rehabilitation, which is used for task-oriented activities, and fine motor skill training is used for activities for daily work.
Yeah. As we said, nerve gliding exercise is an important exercise in post-surgical management of ulnar injury. And we have to concentrate on the joint mobilization also. All the joints are innervated by nerves. So once if the nerve gets damaged, it will not only cause the discomfort or difficulty to the muscle, but it will also cause the joint stiffness. We have to concentrate on that simultaneously with the nerve gliding exercise. In the early period, nerve gliding exercise will be painful for the patients. If you are not addressing because of the pain, the nerve gliding exercise in the later stage of rehabilitation will be much difficult for the students, for the patients to overcome. So that you have to train stage by stage accordingly to the nerve injury. Then only you can get a better outcome in nerve injury. So that you have to keep in mind. So in this case presentation, all of you have explained your aspects in the ulnar nerve injury. For that case, it's a very interesting case. So I'm happy that you all get to know a case of ulnar nerve injury in a road traffic accidents in a bad scenario. In road traffic accidents, usually we will be discussing about the traumatic brain injury or fractures, but we are not addressing about the nerve injuries. In most of the cases, many nerve injuries in a single person can be addressed in the road traffic accident. So nerve injury management also very important in neurological aspects. So try to learn more about nerve injuries. You will get to share more knowledge among yourself. So thank you for this cooperation to everyone. So we'll see in some other video. Thank you.